Greetings. Let us talk about another hemostatic device, and this time band ligator. And these are my acknowledgements. And today's learning objectives include: number one, the different uses of a band ligator and how to set it up and handle the band ligator. Band ligator is widely used for varicose therapy, either for prophylaxis to prevent bleeding or to treat bleeding. In addition, band ligator is also used for managing Barrett's esophagus with high-grade dysplasia, where you place a band and resect that abnormal tissue. The same technique could be used in other locations as well. These are the main uses of a band ligator. When it comes to setup, when you open the package of a band ligator, you will see a band ligator control handle, a loading catheter, and a band ligator cap loaded with bands and attached to a tripwire, and you will also see an irrigation adapter. It's important to figure out how to control the handle of a band ligator. This is one variety of band ligator. There are other varieties, and let us focus on this one for the time being. So when you look at the control handle, notice that there are two positions. One is the firing position, and the second one is the two-way position. In a two-way position, the band ligator control device could be moved in a clockwise and anti-clockwise direction, and this is used when you're loading the device and setting up the device. And you move on to the firing position when you're ready to deploy the bands. In firing position, it only moves in one direction, that is the clockwise direction. So once you take the handle, keep the knob in the two-way position as you're setting it up. It allows loading of the device much more easy. And let us go through the steps of how to set up a band ligator onto the endoscope. So you puncture the seal with the irrigation adapter and insert the loading catheter into the channel and push it till the loading catheter comes out of the endoscope. And then you take the trigger cord and attach the trigger cord to the loading catheter and pull the loading catheter back to remove the loading catheter and the trigger cord through the channel, and load the trigger cord onto the notch on the device, as you can see here, and anchor the knot onto the groove, and then rotate the knob clockwise to wrap the trigger cord around the device. Once you've done this, make sure you attach the band ligator cap to the distal tip of the endoscope and push it all the way back. And when you look at it, if it is not set properly, you can rotate the cap to align the trigger cords in line with the biopsy channel so that you have a clear view. So this is all it takes to set up a band ligator. And before you give the endoscope to the physician. Make sure you keep the band ligator handle in a two-way position so that there is some give to the tip of the endoscope as the thread can loosen up a little bit, so that as the endoscope is going down, it is not in a firing position. I've heard about cases when somebody has given the endoscope with the band ligator in the firing position, and someone accidentally placed a band into the pharynx or into the uvula. So make sure when you give the endoscope, the band ligator head control is in a two-way position, as you can see here. And once you reach the area of interest and you want to band, then the endoscopist pushes it into the firing position and then rotates it in a clockwise direction after sucking the varix into the cap to release the band. So we've learned about the technical aspects of operating a band ligator. So now let us see what happens during a procedure. It is important to notice that most of the varices form from perforating veins entering very close to the gastroesophageal junction. Hence, it is important to start the banding at or close to the GE junction and then sequentially move up. And it's also important to band the highest risk varices, those that are at high risk for bleeding. These include large varices and varices with stigmata of bleeding, either cherry red spots or those with a red whale sign. So we have the endoscope, we go close to the GE junction, suction, and the band ligator head control is in firing position, and you rotate clockwise till you deploy the band. And then you continue the process and apply up to six bands, and some may even do more, but 6 bands should be able to serve the purpose. So we have learned about how to set up the band ligator. We have learned about the importance of the two-way position and firing position. Once the band ligator is set up, as a technician, when you give it to your endoscopist, the endoscope band ligator handle should be in a two-way position. So I hope this is useful. Thank you.